you by Southend Fertility and IVF.
Welcome to the brand new series called Conceive on Medi BizTV. Conceive, this program is going to be a series of programs where we talk about infertility. I am Dr. Anita Mani. I have been practicing infertility for the last 15 years. So, infertility has not only become a career for me, I have learned a lot of things by doing this job for the last 15 years. So, it is my passion and great pleasure to introduce a lot of information to all the young generation and old generation equally on this field of infertility and fertility. Indeed, it has been shocking for me while practicing to see so many things in this modern world changing the way we live has actually resulted in coming down the fertility of our population. 1 in 6 couple have difficulty in having a baby. And we all know that to fulfill our lives, to have a happy family life, we need to have babies. I have been seeing the pain of many patients over the years, which they cannot express to many people, to the society, to their own family members, sometimes to even their own partners. They cannot show the pain, what they have inside and what they suffer many years because they don't have a baby. Especially this is very much true in the case of women who often feel that their life is incomplete and they suffer in silence all the problems that society throws on them because they don't have a baby. What I am going to do here is I am going to systematically go into the various topics related to the field of infertility. So, we will be covering a lot of things, but I would like to do it in a way that this is going to the common people. So, I will try to explain things in a way that you understand what are the basics and what are the reasons why we have so much problem now. So, there are a lot of issues when it comes to infertility. So, in this episode, what I am going to do is I am going to concentrate on the causes of male subfertility. That means when we look at the basics, what are the requirements to have a baby? So, when you see that you need to have a fertilization to form an embryo inside the tube and it goes to the uterus and it grows and become a baby. So, you need to have a healthy sperm and a healthy egg to actually form a healthy embryo. So, I am going to look at the male factors which are important to produce a healthy sperm. So, when we look at the history, what we find is that WHO has made a criteria to see how we can analyze the health of the sperm. The test is called the semen analysis. So, in the semen analysis, what is being done is we are looking at the number, which is the count of sperms, which usually runs in millions. So, the criteria of WHO is coming down over the years. So, initially it was high count, which was regarded as normal, but over the last few years what they found that the count is actually coming down, the sperm count is coming down for everyone. So, the actual criteria of normal is coming down over the years. So, one aspect is the sperm count, which runs in around 20 million we regard as the basic level now. The another one is the movement. The sperms are actually like fish, they move very fast. So, in order to reach the right destination, the sperms have to move very fast and they have to move for a longer period also. This actually happens by the energy released in the mitochondria. So, the movement of the sperm is very important to cause the fertilization. So, that is usually regarded in a few grades, like fast moving sperms which move slowly, which moves in different direction, which moves forward, and those who do not move, and those do actually are dead sperms. So, there is a grading of the movement of the sperm. So, that is the second most important aspect when we do a semen analysis. So, what we realize now is that the actual fast moving or the forward moving fast sperms are also coming down over the years in all men. So, now again the WHO criteria over the years are changing for these criteria also. The other important aspect we look at the sperm is the morphology. Morphology means, to describe in simple terms. If you look at a person, what do we see? We see a head, there is a body, and have limbs. So, the sperm is similar to that. Only thing you have to think about, like tadpoles, like frog has tadpoles, that one. So, it has a head, it has a body, and then it has a tail. So, this is how the normal morphology of a sperm should be, with a particular ratio of the size. So, what happens is that if a sperm is abnormal in genetically, or it is not able to become a normal baby, then the shape or the morphology will be abnormal. So, you have different types of abnormal sperms. You have swollen head, think about a man with a huge head. So, that is like a swollen head sperm, it is abnormal. Or you can have like a double head, or you can have an abnormal shaped tail. So, it could be a curved tail, or it could be a double tail, or when it comes to the body, it can be like a flat body. Okay, so, you can imagine that the sperms can be of normal shape and it can be of abnormal shape. So, what happens is that sometimes these abnormal shaped sperms also fertilize egg. So, what results is a abnormal embryo or like an abnormal baby. So, what happens is that this embryo may not grow after a few days. So, it can go for a miscarriage. So, we know that it is very important to form a normal embryo, we should have a normal shaped sperm. So, that is the third aspect when we look at the sperms. So, when we look at the other aspects, what we look for in semen analysis, there are also other things like the percentage of live sperms and the percentage of dead sperms. See, I am talking about all these basics because when we see what are the life changes what we go through in this modern age, they have specific effect on the sperm. So, each aspect of the sperm is important because the things that we do are actually making them abnormal. Either the count is going down, or the movement is coming down, or they are becoming abnormal, or they become dead. Okay, so, next what we will do is we will look at the aspects of the life, in the modern life, what is changing the sperms to become them abnormal, which results in either repeated abortions or miscarriages, or it results in infertility, or it results in IVF failures, or it results in actually having abnormalities in the children. Now, I am going to actually take you to the childhood. See, when you are talking about a man, there is a boy. Okay. So, look at a boy today who goes to school in school bus. spends a lot of time in the school bus, in the middle of the traffic, he's living in a flat. He's actually sitting in the classroom for around 8 hours, and then he comes back home, and then what happens? He'll be watching TV, he'll be having some fast foods at home, and then after that he'll be sitting down again for his homework, maybe goes for a tuition, and then again after that he'll be sitting down in front of the TV for another couple of hours before he goes to sleep, which is going to be very, very late these days. So what I want you to imagine is, imagine a boy around 20-30 years back living in a countryside. So he wakes up probably around 5-6 o'clock because he has a long way to walk to school. Maybe he goes for playing in the morning. He might be actually helping his parents in doing the cultivation, agriculture, whatever. He is getting in touch with the nature. Then he walks to school, maybe a couple of miles, and then he spends very few time in the school, because most of the schools those days they had classes even in the playground, in the outside, in the nature, and they used to have that lunch breaks where they used to play around, and they didn't have laptops and computers and mobile phones. So, and then what happened after the school? They come back again walking, maybe playing, and then they go to play. Okay, so when you look at things, there was no mobile phone, there were no TVs and no computers, which has actually reduced the physical activity to more than 90% now. So when you look at how the child was growing in that era, you can imagine that the physical activity had kept that boy healthy in the childhood, and the same health carried on to his adult life. So if you look at the kid now, what happens? There is reduced blood circulation because the child is always sitting, and actually for a child to be sitting for 8 hours continuously in a class, whether it is study or whatever else, it is not healthy. See, the human being or any animal has not been designed to sit continuously for that many hours. So what happens is that the metabolism of the body is reduced, the blood circulation of the body is reduced, and more importantly, so because we are looking at the fertility point of view, the scrotal temperature is high when a man or a boy is sitting. Why the scrotum or the testis, which is a reproductive organ in a boy, is kept outside the body? See, when you think about it, nature has designed a man with the scrotum outside the body for only one purpose. The temperature of the sperms when they produce, it has to be 2 degrees less than the body temperature. Only then the spermiogenesis or the production of the sperm happens normally. So what happens here is that when a person is sitting down for a prolonged period, the scrotal temperature, instead of being low, is actually higher than the body temperature because of the prolonged sitting. So what happens is that the sperm production is markedly reduced starting from a teenage. And then when you look at a further development of the boy, what happens? Then he goes for an office job, or perhaps he will be working with a computer. So the same pattern is being repeated. So instead of that, it's becoming a natural normal production, the sperm production is reduced markedly. The other important factor is that for the movement of the sperm and for the morphology also, the low temperature is very important. So what happens is that in this procedure, not only the sperm count is reduced, the motility of the sperms are reduced, and there are abnormal sperms. So no wonder that in the semen analysis over the years, it is coming down drastically. Just because there are millions of sperms, we are still able to have babies. Otherwise, we probably would have actually become an extinct population if we change your lifestyle in this way. consider the other aspect. Again, going back to the story of the boy who was there for 30 years back and the boy living now. What do the boy eat? So, that is a huge topic where you can discuss hours and hours and days on end. And then, I've gone through so much of research material and so much of things, and what I found that what we think as development now probably is not really development. What we used to eat many years back, whatever little we used to have, probably was much more nutritious. It was enough for us to eat less, and it was actually healthy for all aspects of a human being, not just the fertility. It was more healthier because there was always less amount of diseases like diabetes, hypertension, high cholesterol, cardiovascular diseases, and importantly infertility or subfertility. So, the diet has a very important role, and I will be actually covering a whole episode only on the diet, especially focusing on the male fertility. Another important aspect when you consider fertility is what people have as a bad habits. Although alcohol consumption has been there from probably centuries back or since mankind was found, whatever, the consumption of alcohol has gone up very drastically these days. And not only that consumption has gone up, the additives that they use along with the alcohol or the effect of the smoking or the effect of drugs have actually changed drastically over the last children have started going into these things. So, these are also having marked effect on their fertility along with their health. The other important aspect in when we consider male subfertility is actually the amount of stress, the amount of strain a person has to go through has also changed a lot, and the effects of stress are very clear. See, if you look at the number of children born, if you look at the census, what we see is that during the war, the number of children born were very less. But after the war, there was a baby boom time. So, what happens is that when you have a period where you go through a very stressful period, the adrenaline in your body, it goes up very much. So, the adrenaline is actually a contraceptive. See, if you do not know what is adrenaline, it is just a stress hormone. Okay, so when you are stressed out, when you have a problem, it's like you want to run away. So, that particular hormone which is released to make you go through that reaction is adrenaline, and this is actually like a contraceptive. So, what happens is that people do not have children when they are under stress, and what is happening now is that people are under stress constantly, not just during war or doing a problem or anything, but almost every day people are stressed out. And for what? For this so called development, which is actually not development, it is actually going back. So, each aspect what I have explained, like the food habits, the amount of physical exercise, the bad habits, stress, and all these things have made changes. I will go into each subject deeply along with all the research material which is proving all these points, and also I will give you tips how to actually change this. It is not like there are problems and we cannot sort it out. There are alternative methods. So, we will go through each subject deeply and we will find out what is the solution for that. So, what I want you to do is that I am going to do a program on each subject separately for every week, going into deeply, giving solutions. So, what I want you to do is a small homework. I want you to think what you do from morning till evening on a particular day. I mean, most of the people have uniform days these days, there is no difference. So, what I want you to think and evaluate and analyze what you do the first thing in the morning. first 1 hour what you do, first second hour what you do, how do you have your breakfast, how do you get dressed, how do you travel to work if you work, or if you're at home, what do you do at home, and then how do you work, what is your posture when you're working, do you sit down, what do you do, and what do you eat, what do you eat for your break, what do you eat for your lunch, or what do you eat when somebody's treating you, how many hours you work, which posture you take, and how much steps or how much movements you take every day, and then after work, how do you again spend your time, how do you travel back home, what do you eat for dinner, what time you eat your dinner, what exactly you have for dinner, what do you do after your dinner, how much time do you spend in front of the computer, how much time you spend on your mobile phone, how much time you spend in front of your TV, and all these things I want you to analyze. If possible, you can make a note of it in a diary, and then I will go into all these things deeply, and you will see how much unhealthy or how much bad things really are. Okay, so I'm really happy to do this program on infertility and to help people lead a healthy life, to become fertile. And on this series of Conceive, we'll take you through all the aspects of fertility. And you are welcome to attend all these sessions and give a feedback to us on Medi BizTV, Conceive, Dr. Anita Mani.
This program is brought to you by Southend Fertility and IVF.